Thank you for all those questions on Instagram. I try to answer most of them. You have to understand that I receive up to 40 to 50 messages per day sometimes, and I try to answer all of them as quickly as possible. So if you're wondering why I answer in just a sentence or sometimes in a word, it's because I have plenty of messages to answer. So keep the questions coming. If you want me to cover any specific topic, please let me know. So today I wanted to cover the topic of registration exams in Germany. I wanted you to understand what the registration exams in Germany are all about. So after you've finished or you've got your B2 language certificate, you have to take 2 exams in Germany, as you all know. Both of them are oral viva exams, so there is no written exam to become a doctor in Germany. You obviously need to get your B2 German language certificate, and of course you have to send your documents, you get appointments for the first exam and then the second exam. And after you pass the second exam, you are registered as a doctor, or in German they call it, you get your approbation, which is nothing but a permanent registration. And once you have your approbation, Approbation like they call it in German, you are free to apply anywhere in Germany, and you are just like any other German doctor. So getting your approbation is the most important thing. So once you have your B2 German language certificate, the 2 exams are Fachsprachenprüfung and the approbation exam, or it's also called the Gleichwertigkeitsprüfung or Anerkennungsprüfung. So these are the other names for the second exam. So now let's try to understand what these exams are all about and why they are conducted. You might have heard of the UK exams like PLAB or the Australian Medical Council exam, the AMC exams, or the USMLE and these kind of exams. The German exams are nothing like that. You have to understand the German exams are not the systematic exams that you would find in other countries like the US, UK or Australia or whatever that is. Now, the first exam, the Fachsprachenprüfung, was brought in around the year 2013. And this is because most doctors in Germany, even though they had the B2 certificate and had passed the approbation exam, couldn't communicate with patients. And this is why they brought in this new exam, the Fachsprachenprüfung. Basically, what you do here is they ask you to take a case in German from a patient. Usually it's an actor saying he has abdominal pain or he has all these symptoms. They want you to see if you'll be able to elicit good history in the German language from a patient. This is what they're checking. So they are not checking your medical knowledge. They're checking your German medical vocabulary here. Basically, they want you to see how you will take a case when the patient is speaking German, whether you're able to understand what is being said, whether you're able to interpret it, and then write down a case. So this means a doctor-patient conversation, which is nothing but case taking. And after you've taken the case, you have to present it to another doctor. So this is a doctor-doctor conversation. So case taking and case presentation, in other words, in the English-speaking word. It's not like your PLAB exam or USMLE step 1. It's nothing like that. Basically, they are checking your German medical vocabulary. If you're able to use medical terms, if you're able to because this used to be a big problem. I remember when I was in Germany, in the first 2 years, there were complaints from so many patients that the doctor, a foreign doctor, is not being able to understand what they're saying, and they are not able to communicate with this foreign doctor. And this is why they brought this. This has got nothing to do with your medical knowledge. This is to check your German medical vocabulary, whether you're able to understand medical German and ask the questions from the patient. And I think it's a fair exam. Anybody who wants to work in Germany should be able to communicate with patients and should be able to understand what the patient is trying to tell them. So this is the first exam, and it has got nothing to do with PLAB. It's not a similar exam to PLAB 1 or USMLE 1 or AMC 1. It has got nothing to do with it. So now let's say you pass this exam. You have elicited a good history. You're able to present it well to the examiner, and most of them pass these pass this exam. If you are able to speak decent German, you will be able to pass this exam. Once you pass this exam, you have to make an appointment for the next exam. And this is the most important exam. This is the Approbationsprüfung or the approbation exam, also called the Gleichwertigkeitsprüfung, also called the Anerkennungsprüfung. So if you look at the different names of this exam, Approbationsprüfung means an exam, Prüfung is exam. Approbationsprüfung means an exam to get your approbation or to get your permanent registration. Gleichwertigkeitsprüfung, what does that mean? Gleichwert means something of a similar worth, or gleich is equal, wert is worth, something of that is of equal worth. What this means is, if a candidate is coming from a non-EU country, his degree is not considered equal to a German degree. So it's not gleichwert, it's not worth the same. So you have to equalize the worth of your foreign non-EU degree with a German degree. And this means you will give a Gleichwertigkeitsprüfung, an equalization exam, wherein now your degree, once you pass this exam, your degree will be considered equal to the German degree, and hence you get your approbation or Approbation in German. The other name for this exam is Anerkennungsprüfung, means a recognition exam. Basically, they're recognizing your foreign degree. Needless to say, EU candidates don't have to take this exam. A candidate, a doctor coming from, let's say, Romania. Romania is in the EU, as you all know. A doctor coming from Romania need not take this exam because his degree is considered equal to the German degree. So he doesn't need an approbation exam. But he doesn't speak the same language that's spoken in Germany, that is German. So he has to take the Fachsprachenprüfung exam, where they're checking your German medical vocabulary for obvious reasons. Even though his degree is considered equal to the German degree, the language is not the same. So he has to take the Fachsprachenprüfung, but not the approbation exam. All other non-EU candidates have to take the Fachsprachenprüfung and have to take the approbation. There are no exceptions made to this. So in the approbation exam, or the Gleichwertigkeitsprüfung, or the Anerkennungsprüfung, what they are checking, again, this is nothing similar to your USMLE Step 2, Step 3, where you have to study for months. You go through all the subjects, psychiatry and this and that. This is nothing. This is nothing like that. Nothing like your PLAB exams. This is one of the easiest exams that you can take. No other country will literally gift you an exam like this. So Gleichwertigkeitsprüfung or Approbationsprüfung is an oral viva exam. What they want to check here is whether you are able to handle yourself in a hospital in emergency situation. The main concept is emergency situations, and whether you'll be able to recognize common diseases or common conditions that appear in the hospital. For example, the exam differs in different states. There are 16 states in Germany, and each state has a slight variant to this exam. So I took my exam in the southern state of Bavaria. The other name for Bavaria is Bayern in German. So I took my exam in Bayern, and my exam had 3 subjects. So internal medicine, general surgery, and a field of my choice. So before the exam, I had sent my documents, and I got this letter saying I was supposed to take this exam 3 months later. And for this exam, I would have an examiner who was a general surgeon, I would have an examiner who was an internist, and the third field would be a field of my choice. So they had given 16, I think it was 16 different fields: ophthalmology, orthopedics, and ENT, and I could choose one of these fields, psychiatry. I chose orthopedics because I was always strong in orthopedics. So I got to choose my third field. Now, this is not the same in all states. In some states, they give you the third field. You have no choice. You have to take what they give you. But in Bavaria, where I took the exam, I could choose one of the 12 or 16 fields that were there, and I chose, it was a field of choice, and I chose my third field to be orthopedics. So my 3 of course, I had to take the internal medicine, general surgery, and the third field was orthopedics. So obviously I prepared for this. You don't need any fancy books to prepare for this. Your Oxford handbook, or the whatever that's called, the handbook, Oxford textbook, the small book of emergency medicine, of internal medicine, those books are more than sufficient, and you can read it in your native language. I read all my books in English, obviously, because I knew how to translate these conditions. And I keep getting a lot of questions on candidates asking me, will we have trouble understanding the medical terms in German? The German medical terms are basically Latin. Yeah. Anterior cerebral artery is arteria cerebri anterius. So you see, it's the Latinized form of the medical term. So you don't have to worry. Even if you say it in English, nobody will care. None of the German examiners will have a problem if you say anterior cerebral artery. Don't worry about these things. Just learn the basic emergencies. Just to give you an example, I will go into the details of my exams of my particular approbation exam in a future video, but I'll give a broad overview of what they asked me. So not only did they give me a field of choice which I could choose from, they also told me who the examiners were going to be. So I knew who the examiners were going to be. So one was a professor, two of them were professors in the University of Würzburg. That was the university which was covering my area where I was working in. And another professor had come from, I think, Munich. I'm not sure, the third examiner. So it is said in Germany that, you can call your examiners beforehand to say that, you're a candidate who's taking the exam and that they are going to be the examiner, and you just wanted to introduce yourself to them. Now, this is tricky. Some examiners take this in a very positive way. Some of them might think you're trying to influence them, but I decided to take the risk and call my examiners, and they were very friendly. They said, don't worry, it will be nothing out of the ordinary. You will have simple questions and you don't have to worry. This is all they said. So you just basically are introduced. You're not going to ask them, what are you going to ask me? No, you're just introducing yourself. Now, this has to be taken with a pinch of salt. I will go into the details of how these exams are structured and what exact questions they asked me and what you can expect in the future. So basically I went there, the three examiners were sitting in front of me, a table and a chair. I sat in front of them, and each one asked questions for about 20 to 25 minutes. So one asked me about the general emergencies in internal medicine, one asked me surgical questions, and the third one, orthopedic question. So basically, this was absolute basic. Even a second year MBBS student, second year medical student would have been able to answer this. Obviously, the questions were extremely easy for me. I absolutely smashed the exam. Not a single question went by which I couldn't answer. Of course, there were some tricky situations which I will explain in a future video. Basically, I smashed it, and each examiner asked me questions for 20 minutes. And after an hour, they asked me to go out for 2 minutes, and they asked me to come in, and they said, you know the result. It was a straightforward thing for us. You obviously have passed. Right there, they will give you a degree. Here is right there, they will give you your Approbation, your approbation certificate. Here it is, and that's it. I was registered as a doctor in Germany. It was that easy. And I still hear candidates failing this exam, and I don't know how they managed to fail this exam. A normal Indian or Pakistani graduate should be able to pass this exam. If you cannot pass this simple exam, you don't deserve to be a doctor in Germany. As I'm sorry to be harsh, but it's as simple as that. It's the easiest exam that can be expected from a medical graduate. I will go into the details of the questions asked to me in a future video, but it is the easiest exam that you can take. If you cannot pass this, just give up. Stop being a doctor. It was that easy, and this is what I wanted to cover in this video. Don't worry, it's got nothing to do with step 1, step 2, step 3 or PLAB 1 where you have to study all kinds of subjects. It's the easiest exam. They want you to pass, and there are doctors still failing this from some of the countries from the East. I hope this video helped you. If you liked my content, don't forget to subscribe, click the like button. If you have any questions, please post them on my Instagram. I'll try to answer as many as I can. And if you want me to, if you want a topic to be covered in one of the videos, don't just write them in the comments section or post it in my Instagram, and I'll try to make a video on it in future. So see you in the next video. Bye.